morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Today it is part of competency in physiology. Cardiovascular response to hypovolemia. I will present as a case. This is a history of a 35-year-old healthy male involved in car accident, and he sustained severe lacerations and acute loss of around 1 liter of blood. He is promptly rushed to the emergency department where resuscitation is done. So today we'll be discussing what are the cardiovascular response to hypovolemia. As per ATLS, there are 4 classes of hypovolemia depending upon the percentage of circulating volume loss. When more than 40% of blood volume is lost, approximately 2.5 liters, this is stage 4. Usually this patient will be having tachycardia, their BP will be decreased, they will be lethargic, and there may not be any urine output also. The class 3 means around 30 to 40% of the blood volume, around 1.5 to 2.5 liters. The stage 2 means the heart rate is more than 100, usually around 15 to 30% of blood volume is low. So whenever there is tachycardia, heart rate more than 100 to 120, think that around 20% of the blood volume, that is 750 to 1500 ml blood is lost. Class 1 is less than 100, only slightly anxious, the pulse rate will be normal, urine output will be approximately again normal, and blood loss is less than 15%, that is 750. So the classes are class 1 less than 15%, there is no hemodynamic problem. Class 2, usually there is tachycardia, 15 to 30% of the blood volume is lost. Class 3, more than 120, it is significant, 1.5 to 2.5 liter or approximately 30 to 40% blood volume is lost. Class 4, patient comes in shock, 40% of the blood is lost. And now let us think what are the response, cardiovascular compensation, the immediate response, that is within minutes. It is the baroreceptors, activation of the autonomic nervous system, the sympathetic nervous system, and release of antidiuretic hormone vasopressin. The baroreceptor is a sudden decrease in blood volume detected by baroreceptors, the high pressure baroreceptors located in the carotid sinus and aortic arch. They trigger immediate sympathetic response. Activation of the sympathetic nervous system leads to vasoconstriction of peripheral blood vessels, which help to maintain blood pressure and redistribute the blood to vital organs such as brain and heart. The adrenaline is secreted from and noradrenaline is also secreted from the adrenal medulla, also contribute this. Adrenal medulla is part of the sympathetic nervous system. The release of vasopressin from the posterior pituitary enhances water reabsorption from the kidney, conserves fluid, and contributes to maintenance of the blood pressure. So here we can see the baroreceptor response. The afferents are coming from the 9th nerve and the 10th nerve, and the autonomic surge, the sympathetic efferents will go to the heart, it increases the heart rate, activate or increase the automaticity of the SA node. Contractility of the heart also increases. At the same time, this stimulates adrenal medulla, releases the circulating catecholamines, having the same response. At the same time, as the baroreceptor response is decreased, because when the 9 and 10 they are pressure receptors, the response is less, the vagal output is inhibited. So basically there is activation of the sympathetic nervous system and inhibition of the parasympathetic nervous system. Next is the vasopressin. We have said from the posterior pituitary, when the volume is less, the ADH secretion or the antidiuretic hormone or vasopressin is released. It acts on the kidneys and the diuresis is inhibited. So far, we have discussed about the immediate response by the baroreceptors, high pressure baroreceptor, and the vasopressin response. In addition, there are low pressure receptors are there in the atria. When the venous retained atria is decreased, inhibition of the release of the atrial natriuretic peptide. When the atrium is stressed, it produces release of the atrial natriuretic peptide or ANP. So here, when the volume is less, the release of ANP is inhibited. ANP has got vasodilatory effect, renal vasodilatory effect. It will facilitate natriuresis. So this is another mechanism by which natriuresis is inhibited and will help in increasing the blood pressure. Another mechanism that is occurring immediately is the transcapillary fluid redistribution. That is, when the pressure or the volume is less, when there is a hemorrhagic shock or any cause of hypotension, the capillaries, the arterial and the capillary goes into constriction. This will reduce the pressure at the venous end and will help in reabsorption of more amount of fluid from the interstitial space in the vascular compartment and help to increase the blood volume. So these are immediate responses. Now we think about the short-term response that occurs usually within hours. The most important is the renin, angiotensin, aldosterone system. Whenever there is hypotension, the juxtaglomerular apparatus will produce release of renin that act on the angiotensin 1 produced by the liver, convert to angiotensin 2, and this angiotensin 2 is the most potent vasoconstrictor. So this will help to increase the blood pressure. At the same time, this act on angiotensin 2 act on the adrenals. The zona glomerulosa releases aldosterone. Aldosterone will produce reabsorption of sodium and again increase the blood volume, and this will help in maintaining the blood volume and blood pressure. So renin, angiotensin, aldosterone, renal protection or renal role in the cardiovascular response to shock is very important. Along with it, the cortisol is a stress hormone. Whenever there is stress, cortisol is released by the CRH, corticotrophin releasing hormone, act on the pituitary to produce ACTH. ACTH act on the adrenal cortex to produce the cortisol. Cortisol will increase the blood sugar. It is a counter hormone for the insulin. At the same time, it has got some mineralocorticoid activity and help to increase the fluid volume. So we have discussed the immediate response, short-term response. Now go to the long-term response. The long-term response, the renin-angiotensin system will be continuing. At the same time, the hypoxia will stimulate the kidneys to produce more amount of erythropoietin. So erythropoietin will increase the production of RBCs and help to improve the oxygen content of the blood. So today we have discussed about the immediate response by the baroreceptors, the vasopressin, ANP, inhibition of the ANP, and the renin-angiotensin aldosterone system and cortisol, and finally the long-term response by the erythropoietin and also continuation of the renin angiotensin aldosterone system. Thank you.